people who are living with dementia, to help people understand the condition, because people don't understand the condition by and large.
How is in terms of the care delivery or across, what are the key things to be notifying or to be understanding from a family point of view when you have a family member living with dementia? And where does the system supports and where does the system leave some gaps for the families and communities to fill around?
So I think the important thing to recognise for people who are living with dementia is that they have to navigate one of two systems. So if they have young onset dementia, they're under age of 65, they need to navigate through the NDIS. And if they're over the age of 65, through the aged care system, on top of all of the things that they need to be working through as well, like their primary care, their acute health sector, community health. So these are all really important things to think about for people who are living with dementia, and it's incredibly complex to work your way through either of those systems, and they're not particularly easy to navigate at the best of times, but if you're living with a cognitive impairment, they can be just even a bit more difficult. So that's why Dementia Australia has been calling for the federal government to invest into navigations for people who are living with dementia, to help people understand the condition, because people don't understand the condition by and large, but also to understand and get to the help they need in a timely manner.
Everybody who would have young onset dementia, almost everybody is on NDIS, or are how many are falling through the cracks?
So we don't have, or I don't have the latest figures to hand, but unfortunately, no, the vast majority are not on the NDIS. And so
it is not seen as long-term permanent disability, or is it some other reasons?
So there's probably a range of reasons. Some of it is about accessing the NDIS, and some of it is about having access through other areas. But there are significant challenges for dementia in the NDIS. It's not a stable condition. It is a progressive neurological condition. And so, people will say that they often can struggle, depending on who's doing their assessments in the NDIS, about understanding dementia as a disability. So it's important that we are making dementia and NDIS closer, so that we know that the people who are working in the NDIS and doing the planning and assessments really understand, what dementia is and the supports that are needed, and also that things change over time, and we need to have it quite responsive to those changes. And then on the flip side, we also are really concerned to make sure that people who have a diagnosis of dementia, if they're diagnosed, they also get the allied health supports they need. And so that is not NDIS necessarily or aged care, but, through chronic condition management, making sure that people are starting to think about, and GPs are starting to say, well, this is a chronic condition, and so we need to support you with some chronic condition plans.